Greetings all, Dr. Zilke the Fall Fixer here. In this video, I am going to discuss and read an article in my local newspaper by a local physical therapist who has a practice and specializes in geriatrics and specializes in fall prevention. I think it's a good article, and I'm going to read it and give some commentary and some insights from my personal experience. But first, I'd like you to please like this video and please subscribe. That way YouTube knows you like me and it gives you information as far as when I'm putting on new videos, and I really would appreciate it. All right, see you on the other side. Thank you. So here we have an article by Dr. Beth Templin, PT, DPT, Geriatric Physical Therapy Specialist, and she wrote an article called Top 6 Things That You Can Do to Decrease Falls. Opening sentence here, which I like, is even though falls are more common as you age, they are not a normal part of getting older. That is true. That's the one thing. I love the way she started this off with. Yeah, if we expect to fall, it may happen. That we won't put the things forward that we need to do to prevent it. And if we consider it not part of normal aging, we'll not accept it and we'll work to get better. So please, I could not agree more with that. And there are several things you can do to help decrease your fall risk. All right, nice segue, which I agree with. So the first one she talks about is here. Get your eyes examined annually. The more trouble you have seeing clearly, the more prone you are to slips, trips, and falls and tumbles. That's true. On the surface, it looks like, yeah, if you can't see something, you'll walk into it, be more likely to fall. True, I could not agree more. But there's another side of things, which is a deeper dive into this here, that as we lose vision, it takes our brain longer to process the things we're seeing. If it's unclear, if what we see is out of focus, either by darker light or whether it's by foggy glasses, dirty glasses, our brain needs a little more time to put all the information together to let us know what is happening. And as we age, that time difference is crucial because not only are we learning the information slower, but then our reaction times are also a little bit less. So we're setting ourselves up for a greater fall risk by decreasing vision because we can't see it quick enough, we can't process it quick enough, and we can't react quick enough. So it's more than just not seeing clearly. It's the whole system that sets you up for a greater fall risk. So yeah, get your eyes checked, pay a little extra money for the glasses. I hear from patients quite a bit, and I get it, the expense of glasses, but it is something that's very valuable and something I'm sure that family would love to help you with if they just would know how bad your glasses really are. So next one here. Have your meds reviewed every year. Identify medications that might be contributing to your fall risk. This is a tough one. It really is, and I agree with it because I recall a long time ago when I first started doing physical therapy and home health care, and like all physical therapists who've done home care, well, maybe not all, me, I could still drive you to this lady's house, and I can remember our care. I do not remember her name, though, it's the way it is. So I remember her well. We were struggling with keeping her on her feet, struggling. She would try so hard, but she would just be dizzy and the balance just wasn't there. And it wasn't until the family intervened and they made some medication changes. And with her case, well, I'm not going to say what it was. So they made some medication changes, and it was night and day. The next time I saw her after that, she was an entirely different person. So medication changes make a big difference in your ability to walk and your balance. But there's a problem here sometimes that medical doctors are reluctant to change your medications very frequently. They look at your lab values, they look at your other health issues, they look at your diabetes, your hypertension, your cholesterol levels, and they consider those life essential things and are really slow to make changes. And sometimes that's a problem, and that's a two-way street. I have a nurse practitioner who I'm friends with, and I hear her talk quite regularly that patients want to get off medications, but they rarely do their part to help her get them off medications. That they don't do the exercise that they need to, example, lose a little weight or change their diet enough so that their cholesterol levels are low enough so that she feels comfortable changing her medications. So, in all honesty, my friends, a lot of this is on us, a lot of this is on you. If we want a medical doctor to change, to work with us on our prescription desires, we need to do our part and get ourselves healthier to help them help us to do that. So that's my follow-up with that. I think that's crucial and not talked about enough. Scroll on down here. Next one here. Make your home safer. Decrease clutter and lighting. Ensure railings and add grab bars to the bathroom. There are a lot of different videos and articles on the subject, and it is all very similar, very common stuff. Remove throw rugs. You can trip on those as your steps get shallower and shallower. You tend more likely to trip. Clutter is an issue. So yes, all this is true, and there's plenty of other videos on that. And this is a good place for, again, a home hair physical therapist to look at your house and give you information on that. It's not much I can really add with this one here. Next one, tell your doctor. Talk openly with your healthcare provider about falls you've had and discuss any fall risk and prevention. In my humble opinion on this one, if you think you're a fall risk, please tell your doctor. And if that's the case, ask for a physical therapist intervention. Most doctors really don't have a lot of experience about the nuances of it. And when you visit them, they're focused on a lot of other things. Your lab values, other healthcare concerns they're working on. So I'm going to be the one to say you don't give them all the details about your walking at the house. Just be concise, be clear, say, hey doc, I'm feeling unsteady on my feet. Do you think I could see a physical therapist in my house to have a checkup? And I think that's the easiest and quickest way to go. But be upfront with it, be concise, and I really think most doctors want to work with you and keep you healthy, and they'll work with you. So tell them that way. Keep moving and exercise. We have the fifth one here. Lack of exercise leads to weakness and increases in your chances of falling. And that is true. It is movement. In my other videos, I'll talk quite a bit about that, on the types of exercise that I feel are the most valuable for this, developing your skill, improving your abilities on your feet, your control of your body, are more crucial than strength, I feel. And then you can look at some of my other videos on this topic. But so yeah, by all means, exercise. Keep moving. Get as much as you can in that's appropriate, and just plan on continuing that for the rest of your life. There's no other way around it. If you need guidance in this subject, yeah, see a good physical therapist for it here and get some input, see what you can do, what you can't do, and work on your ability to move more and to move better. Balance screening every year with a physical therapist. Identifying issues early makes them easier to address. Yeah, I agree. I don't know if you need to see a PT every single year on that. If you're having issues, you would qualify for physical therapist assessment. Some physical therapists will see you at a cash pay basis, but in which case you want to have some interaction with them to improve your skills. In some cases, if you're moving pretty well already, there are personal trainers in gyms which can improve your ability. I'm a believer in so much that if you do the right things, if you keep moving, if you keep building your capacity for activity in life, you're going to go in the right direction. You're going to get stronger and more mobile and less likely to fall. So if you're going in one direction, it's hard to go in the other direction. So keep moving, keep exercising, get stronger. If you need some specific work, that's where the physical therapist could come in. If you're really doing pretty well, that's a nice job for a personal trainer at the local gym. I am a big believer in exercising in a gym for everyone. I think the usage of the weight machines and even the free weights have a very powerful effect on improving our strength and our abilities. All right, let's keep moving here. So many people wait too long to address their balance concerns. Maybe they think it's their balance issues resolve on their own. They usually won't. Human beings tend to get weaker unless we make our body get stronger. I say in patients regularly, we hit our peak when we're 25 or so, and from there on, for the rest of it is basically downhill. The question is, how slow is it? And if we put effort into it, we can keep us at a high functioning level until the end of our life. But it takes work. It takes some commitment and some dedication to do it. So before you know it, the fear of falling starts to limit the activity and the world begins to get smaller. I really like this sentence because it comes down to here. It's the fear of falling is actually more limiting than the fall itself. I have observed many people limit their world, make their world smaller, not go shopping, stop going to church, not go on family trips, not see their granddaughter get married in another state because they don't want to walk through an airport. I've personally talked to people who've done all of these things, and it's the fear of falling. Sometimes they don't admit it. They'll say, "Oh, I don't want to do that," but it really is a fear of falling in an airport, not wanting to be the wheelchair person in the airport. All of the things come into play. Our pride is a big factor here, and it will make our world smaller. But it doesn't have to be that way. Let's see the top of the article here. There's also people who think there's nothing that can be done to improve their balance. They believe poor balance and falls are a normal part of getting older and something you have to live with. And yeah, it's not true. I'm telling the truth. With work, if you or someone you love has balance issues and sticks with a program, they can get significantly better, stronger, and more stable on their feet. I promise you, I've seen it so many times. When you identify balance issues early on, they're much easier to correct and improve. True like anything else. When you take action, you can avoid having a fall. When you feel steady in your feet, you get to keep doing the things you love, like gardening and walking the dog, traveling, playing the grandkids, and all those things as well. And there, after this, she has a promo about herself. And I have no trouble in this video here. So, off at www.housefitstl.com in St. Louis there. If this is a fit for you, I have no trouble giving Dr. Beth Templin the plug there. So, a nice article and some very good information that I think I give her all the credit in the world for creating it and putting it out there in the world. So, I thank you for your time. Hope this was helpful. And check out my other videos on the subject of falls, fall prevention. And please like and subscribe. I appreciate your time. Have a great day. Thank you.